So, good morning, good evening, good afternoon, class, and allow me to take this opportunity to thank Dr. Wendy for allowing us to have this kind of presentation, which help us to be a little bit confident with what she is teaching us or what we are learning from the class. I am going to do a presentation, and before I do what I'm gonna do the presentation about, I'll say my name is James Stanley Kimani is my name, and I'm a biology 260 class student here in Grover Park, and today being the 15th of May 2026, I want to present or do a presentation about mumps. In this presentation, I will discuss the mumps virus or pathogen, the disease as a mum, transmission, diagnosis and treatment, and the current research. We'll ask ourselves, what is mumps? Mumps is a contagious viral disease, best known is causing swollen in the salivary gland. Mainly it affects the children and young adults. Preventable through vaccination, and my origin being a Kenyan, this disease also affected the people in Africa, and we used to call it mungai or matumbwitumbwi in Swahili. What are the key factors about this disease or this virus? Before the vaccination, mumps was very common worldwide. You could find people with swollen cerebral glands, people with loss of appetite, and mom used to infect many children before vaccine became available, and that outbreak still occur today. Doesn't mean because mumps is no more there. Doesn't mean that since we have the vaccination that mum is gone. It's not. We still have those outbreaks, especially in Africa. You hear these cases every now and then. The classification about this virus. Sorry about this. Virus classification. It belongs to the family of Paramyxoviridae. Is a genus is orthorhombivirus, and it's also an enveloped virus. Single-stranded negative sense RNA virus. Some of the characteristic, it's fragile outside the body, replicate inside human cell, uses service protein to infect cells. Viruses reproduce by making copies of genome inside host cell. RNA viruses uses enzyme called RNA dependent RNA polymerase or related enzyme in the retrovirus to copy RNA. This enzyme are usually much less accurate than DNA copying enzyme used by cell and many DNA viruses. Some of the structures of the mumps virus. viral structure. It's a lipid envelope, RNA genome, service protein, and among the service protein is HN protein and fusion protein. What are the functions of service protein? It helps viruses attach to the cell. It also allows entry to the host cell, reservoir, and sources. Sources of infection. Humans are the only reservoir. No animal carriers exist. Carrier exist. Why this matters? It's easier to control with vaccination. Human to human spread only. Transmission. How mumps spread. Respiratory droplet, saliva, coughing, and sneezing. So it's advisable for people whenever you're sneezing, whenever you're coughing, either to cover your mouth. You can use your elbow if you're sneezing, and also coughing. Close contact, like if you're close to the person who is infected. High risk setting, among them are school, dormitories, sporting, military barracks. Why? Just because it's crowded, it's easier to spread. This is how the mumps can be spread. A person sneezes and he doesn't wash his hand. He shakes his hands to other people. It enters through the mouth of the other person. It becomes susceptible in the host. Infectious agent grow and stays in the human reservoir. That's why we said it's the only reservoir is a human. Prevention of transmission. MMR vaccination, and in this case MMR stands for measles, mumps, and rubella. Isolation of the infected people, hand washing. Make a tendency of washing your hands every now and then, and covering your cough whenever you're sneezing. Cover it. Avoid sharing food and drink. And the most recommended one is isolation. When you get mumps, for the 5 days after the ground swelling begin, before you even start swelling, try and isolate yourself. After you do the isolation, you will help us to prevent this disease. What disease does, what it causes in our body. Mumps disease main feature is swelling of parotid salivary gland, as I said earlier. Other area affected is respiratory tract, nervous system, and even reproductive organs. That's a visual image of how mumps affect someone in the salivary glands. Signs and common symptoms. These include fever, headache, muscle ache, fatigue, loss of appetite, swollen cheeks and jaw pain. You have a lot of whenever you're trying to chew. Pain increases chewing and swallowing acidic food. That is, if you eat or you're swallowing something, pain escalates more and more and more. Incubation. When you talk of incubation, we are talking of the period it takes. Like, recently we had COVID. Sometimes we are told COVID takes 3 days before symptoms start showing up. For mumps, it will take 16 to 18 days, and it ranges between 12 to 25 days. Important point on this is virus can spread even before the symptoms appear. We had people who never had COVID symptoms. They never had those chills, but they still spread the COVID. So it's better to be precautious. Be precautious. Possible complication. This may include osteoarthritis, ophiolartitis, meningitis, encephalitis, pancreatitis, hearing loss. Most common severe complication in pubertal males. Testicular inflammation occur mostly in adult male. Symptoms: swelling, severe pain, fever, rare outcome, fertility problem, meningitis, and encephalitis. It also affects some nervous system communication. Meningitis, inflammation and membrane around the brain, spinal cord, brain inflammation, rare but dangerous. Neck stiffness, confusion, and shiza. And not to say that if someone is confused, he has mumps. So, there could be something else or some health complications. Frequency of the disease, global occurrence found worldwide. Cases reduce greatly after vaccination. Still occur under vaccinated population. Clouded environment. Mumps outbreak. Recent outbreak example. Mostly, if there is an outbreak, it has happened in college, it has happened in a sport team or military group. Why outbreak occur? It's close contact. Since COVID, we've been taught to keep space, at least 6 foot. Waning immunity over time, boost your immunity every now and then. The MMR vaccine protect against measles, mumps, and rubella, as I said earlier. Vaccine schedule. We have first and second in childhood and later in childhood. Effectiveness is strong protection after 2 doses. So if you haven't taken any or someone hasn't taken, it's advisable to take this. How the vaccine works: immune response, introduces weak virus, stimulate antibodies production, create immune memory. Results is very fast immune response during future exposure. So that means if you got the jab or the shot and you get sick in future, this one will protect you. Waning immunity. Current research: vaccination protection can decrease over time. Important finding: young adult may become susceptible again, like they can be infected again. Boost with doses may help during the outbreak. Ongoing research studying long-term immunity that has been ongoing. Diagnosis: how do doctors diagnose someone with mumps, or how do they tell that this person has mumps? Clinical signs: swollen salivary glands, and that does not mean that if someone has a swollen salivary gland. But this person has mumps. No. Fever, facial pain, laboratory testing, PCR test, antibody, blood test, PCR testing, detect viral RNA. Sample sources. We get samples from saliva, buccal swabs. Advantage of doing a PCR other than assumption because someone is swollen is accurate, it's rapid, and detect early infection. Antibody testing, serology test, detect antibodies against mumps virus type like IgM antibody, recent infection. Whenever you do an IgM antibody, it detects that's the recent infected infections. IgG, this is a past infection or vaccination, so that means if someone has been in the incubation, its IgG is able to detect. Limitation: vaccinated people may have weaker IgM response. Treatment: no specific antiviral drug, supportive care, rest, fluid, pain relief, soft food, ice and warm compresses. Most patients recover fully. Public health is very important. Why mumps still matters. Outbreaks continue globally. Complications can be serious. Vaccination rates are critical. Public health goal: maintain high vaccine coverage, rapid outbreak response. And what are the current research? New data about mumps. Researchers studying boosters vaccination, genetic changes in circulation strains, improve outbreak monitoring system. Research goals: better and long-term protection. Summary and key point: mumps is contagious RNA virus, spread by respiratory droplet, causes swollen salivary gland, prevent mainly by MMR vaccine, no cure, but supportive treatment help. PCR testing is commonly used. Boost vaccine are being researched, even up to date. And as I come to my conclusion, here are some of the references. CDC, that is Center for Disease Control and Prevention. That's the link. We have the World Health Organization, WHO. That's the link. I got these two guys, Robin S.A. Mumps vaccine and prevention strategies, current opinion in virology. And we have this Lubin S.A. Mumps vaccine and prevention strategies, current opinion by virology. Sorry, I mentioned that earlier. J.A. Grant, winning immunization and mumps outbreak science, transitional medicine. Thank you for listening to me, and thank you. My name is James once again. I do appreciate for listening unto me.